Good afternoon and welcome to our daily COVID-19 pandemic brief update. Fellow Kenyans, the COVID-19 disease remains a serious threat to the well-being of our people and the country at large. Our fight against it has achieved results, but we are still not out of the woods yet. The stage where we are in this fight requires that we remain focused and united, because this battle will be drawn out. The behavior and attitude by a few of our people suggests the opposite. There are those of us who, for reasons only known to themselves, do not want to obey the containment measures. If you wait to be affected for you to observe the measures, it might just be a little too late. Remember that observing these measures is to protect yourself and the people that you care for. We rolled out various interventions in combating this pandemic. Among the responses included the targeted testing carried out in several parts of the country. This targeted testing has been absolutely necessary to identify where the virus is for appropriate interventions to be deployed. Since we started this activity of targeted testing, the high numbers that we have tested have also resulted in unearthing large numbers in particular areas that have helped us identify and isolate various epicenters and deploy appropriate containment measures. As we mentioned earlier, the targeted testing confirmed that the virus is firmly established within our community. The numbers we have been witnessing from targeted testing attest to this and shows that none of us is safe from contracting the virus. If you remember, we now have the virus firmly confirmed in at least 34 counties, I believe. And it will not be long before we will be able to confirm this in each and every one of our counties. So it is spreading. It's already widely spread in the country, in the community, and very soon it will be found almost in every county. We therefore need each other to defeat this disease by collectively adhering to the containment measures. I know that we have gone through these measures many times before, and at the risk of sounding boring and repetitive, we will continue to do that. We shall not tire to remind you about them. Boring as we may sound, these measures are the only weapons we have to deploy against the disease. Hand washing, sanitizing where possible, maintaining social and physical distance, wearing of masks, avoiding gatherings, and staying home when possible. These are things that must become part of our daily lifestyles. The containment measures need to be complemented with a changed health lifestyle, which includes eating balanced foods, exercising, and avoiding situations that would lead to mental stress, among others. Eating healthy, getting enough sleep, and exercising is not only key to fight this disease, but is also critical for one's overall wellness. I want to reiterate on the protocols that we issued for truck drivers. The protocols are very elaborate on what is expected of each and every driver as pertains to COVID-19 test. The drivers are expected to undertake a COVID-19 test 48 hours before departing from their point of origin. And they should only travel once they have this certificate in hand. Proceed on then to their journey to cross the various borders. This is important because we do not want to create congestion and a backlog of truck drivers at the points of entry or exit into the country. Unfortunately, we have had to contend with this, particularly at our borders with Uganda. But in order to be able to streamline the movement of these trucks, it's important that this protocol is enforced and observed by truck drivers, by those logistic companies that are moving goods across. Please ensure that your drivers do not depart on their journey within the region before they have obtained a COVID-19 free certificate from their point of origin. Most of these trucks that are carrying cargo for the region originate from the gateway of Mombasa port. And we have testing facilities within Mombasa, in Miritini, at the Coast General Hospital, and other facilities therein which have been described within the protocol. Truck drivers should appear at those facilities 48 hours before their journey, have their samples taken, they will be tested, and hopefully within 24 hours those test results will be returned and a certificate, COVID-free 19 certificate issued, after which the driver then embarks on his journey, because that way that driver will be able to move very quickly across the border without any interruptions. It's unfortunate that some of our truck drivers are not following these protocols and rules, thereby creating a big problem at the border crossing points and causing unnecessary congestion. I want to appeal to them to pay attention to the guidelines, and if they fail to do this, then they will create a problem of congestion at the ports, but they will also create a problem for themselves because they will be held back at all those points for quite a number of days. And we don't want that to happen. Fellow Kenyans, let me now give you the COVID-19 situation as of today. Over the past 24 hours, we have tested 2,892 samples, of which 72 tested positive for coronavirus. This now brings the total number of positive cases to 2,093, while the total number of samples tested so far is 82,946. If we break down the distribution of these 72 positive cases by county, the picture is as follows. Nairobi at 39 cases, Busia 13 cases, Mombasa 8 cases, Kajiado 4 cases, Migori 3 cases, Kiambu 2 cases, Garissa 2 cases, and Kisumu 1 case. The cases are distributed in the sub-counties as follows. The 39 cases in Nairobi are from Kibra, 16, Embakasi South, 8, Ruaraka, 5, Westlands, 5, Langata, 2, Embakasi West, Starehe, and Dagoretti North, 1 each. In Mombasa, the 8 cases are from Mvita, 2, Changamwe 2, Kisauni 2, and Likoni and Nyali 1 each. The 4 cases in Kajiado are from Namanga Border Point 3 and Kitengela 1. In Migori, all the 3 cases are from Isabania Border Point, while the 2 cases in Kiambu are from Githunguri. In Garissa, the 2 cases are from Garissa Town, while in Kisumu, the 1 case is from Kisumu Central. In terms of gender distribution, 50 of these 72 cases are male and 22 are female. Age-wise, the youngest is 11 years old and the oldest is 73 years old. Today, and it is always something to delight in when you have a recovery, we are delighted to inform you that 17 patients have been discharged from our various hospitals. This now brings to 499 the total number of those who have so far recovered from the disease. We thank God and our healthcare workers for this great achievement. The other side of the coin, of course, is when we have a death. And today we are sad to note that we have lost another 2 patients to the disease, bringing our total number of fatalities to 71. Our heartfelt condolences go to the family and friends of these 2 patients. Finally, we continue to appreciate the good work that our healthcare workers of all cadres across the country continue to do under very difficult conditions and circumstances. We can only pray to God to continue blessing them as they offer critical health services to our people. Thank you.
Well, my name is Jimmy Mbogo from K24.
Thank you. My name is Angela Okesh from Daily Nation. One of the target populations that the government had earmarked to test were healthcare workers. How many healthcare workers have we tested so far? And what was the duration of testing?
Kisha kwamba wanatoa nambari ambazo ni za kweli.
Waziri, thank you. I'm Haemba from Ebru TV. My question is concerning the patients in the country. Maybe some of them are actually dying secretly, silently, without maybe government actually knowing what exactly. My question is actually about some of the patients in the country who are actually dying silently, because it's not all about the COVID-19, but a majority of them actually fear going to the hospital. And I do realize that one hospital in Kakamega County suspended its staff because there are no patients. Maybe as a government, what exactly are you doing to sensitize the public in terms of actually seeking medication if at all they actually fall ill?
Helen Aura from NTV.
Kadzo Gunga kutoka runinga ya Citizen. Pengine tu kuweza kufahamu kwamba Kibera imeonyesha dalili za virusi za corona kwa hali ya juu siku za hivi karibuni. Juzi mlikuwa mmetangaza kwamba mnayo mikakati ambayo mmeweka ili kuweza kuzuia kuenea kwa virusi vya corona katika mtaa wa Kibera. Je, ni mikakati ipi ambayo imeafikiwa kwa sasa na ni lini tutaona mikakati hii ikiendelea kuwekwa?
Helen Aura from NTV. Yesterday we saw that there are some people who are at the KMTC quarantine, they were protesting. What is the ministry doing regarding this matter? As there are Kenyans also who have been tested days or weeks ago, yet their results have not been given unto them. Why is this the case? And you've spoken about Kenyans should continue adhering to social distancing, wearing of masks and sanitizing. Yet we see our political leaders, when they gather for these political rallies, themselves, they don't also adhere to this. And yet Kenyans on the other end, when you're arrested, defying these orders, you're being brutally, or rather you're being harassed by the police officers. So where is the balance really in this? Because right now they're really not leading as per the way they ought to.
Okay, thank you very much. Let me begin by the first question, responding to the first question. If I got it right, I think you were talking about people being killed by police. You mentioned about 15 people, and what's the government doing about this? Of course, as a government, we do not want to see in implementing this pandemic that the citizenry suffer in one way or the other. So those particular cases that you mentioned, I'm sure that the government will follow that and investigate the circumstances under which people may have lost their lives. And the necessary then actions should then be taken if some of these people lost their lives in a way that was afoul of the law. So let us leave that, I think, to the agencies that are concerned and the processes to determine really what were the circumstances of these deaths. As a Minister of Health also, I think I'm not too qualified to respond fully to that question. Angela, how many healthcare workers have we tested so far? And how frequently do we test them? I think that was your question. Part of the testing that we have been doing, the targeted testing, has actually been on our healthcare workers. And I can tell you those healthcare workers in the line who are at high risk due to their contact with the initial suspects and patients. For example, the emergency response teams, the rapid response teams, those who then meet them when they are taken to facilities and who are managing them, case management. Those are our first line workers, and we always test them on a regular basis. I believe they are tested every 2 weeks, is it? Within a period of 2 weeks. It could be even earlier. But within a period of 2 weeks, they will have been tested to determine that they are free of the COVID virus at all time. Of course, this is for their protection, to ensure that they remain free, but it is also for protection of those they are testing, because some of those they are testing, many of those they are testing will generally be negative cases, and we don't want transmission from a healthcare worker who may be infected being passed on to a subject who's being tested. So that is the protocol, that is the duration of testing. In terms of the numbers, I don't have those numbers on my fingertips, but we have a large number of healthcare workers throughout the counties. The protocol applies, they must be tested. And I think we can work out the figures and get them to you if those details are necessary. KBC, the question was on those contacts whom we are tracing. Well, I wouldn't say the contacts, yes, there are contacts being traced, some of whom turned out positive when tested, but could not be followed up because the information provided was not accurate and could not lead us to these individuals. We know that number. I think it has been shared here before. As of the last time, we were talking about 140 individuals who fell into this category. We are beginning to look back to see what data from the case information form that can be used to try to trace them. And there are other data that can be used, particularly, for example, if an ID has been presented, you know very well that that ID can be used to be able to trace an individual. So we are working on whatever possible information that we can get to try to make sure that we are able to trace these individuals. They could also be traced through further contacts, because all these contacts are in some way connected. So we're also looking at those connections between contacts that we may have a handle on, to try to get to those that we don't have a handle on. Remember, patients dying silently, mainly because they fear going to the hospital, or the services within the hospitals may not be available. Am I correct? Is that a question that you are posing? Yeah? Yes, yes. So patients are basically not going to the hospital. And we are very concerned about this. We have already talked about this on several occasions. One of the reasons we believe that patients may not be going to the facilities is because this whole coronavirus thing has in some way been stigmatized, that people fear that they will get it from a facility. And we have repeatedly informed Kenyans that as a ministry, our role is to ensure that they are able to get the health services they require within a facility without endangering their lives or without putting them at risk. This particular coronavirus, of course, has created a complication for us in the sense that we must be able to exercise a stepped-up approach of infection prevention and control. And we're doing this in all our facilities. The counties are doing it. They are fumigating and sterilizing some of the facilities so that patients can feel comfort that when they go to these facilities, they don't stand a chance of being able to contract the disease. So that, I think, is a message that we will have to continue and deliver to people in different ways to give them that confidence that they are safe going to a facility. And I want to say here that they are indeed safe going to most of our facilities because those measures have been put in place. Strict infection prevention and control measures are in place. There are protocols. There are teams who work on these things on a day-to-day basis to ensure that that environment is safe for anybody coming to seek healthcare services. I do not know what the other reasons might possibly be why people would not want to go to facilities and prefer to suffer at home and eventually die at home. I think that is something that we clearly want to send a strong message to Kenyans, that the facilities are there to serve you, they are safe, and you should seek services in those facilities when you have any medical condition. Citizen, Kibra, with its large numbers, what is the government planning to do? We are continuing to watch this epicenter within Kibra and very, very closely. We're looking at where this cluster may be, mapping this cluster. It is possible that it is not the entire of Kibra where we are getting this high transmission, but some particular pocket. We are identifying and mapping that. And I think once we have enough information and we feel that the numbers have now reached a point where a particular measure needs to be taken, as I said before, these measures are always on the table. Those measures will be taken. As soon as we feel that that moment has arrived and that trigger has been reached, that trigger point has been reached. Yes? Well, what I can say is that informal settlements again present their own unique challenges that we need to look at carefully. And I can tell you that even as we look at these numbers, healthcare workers are fully looking at these particular facilities. We have engaged all our community health workers, for example. They are working within these communities, and we are sending the message and making sure that even those areas where it is happening, we minimize the amount of movement and mixtures. So we need to do that. That is part of the duty that we do. Now, in terms of putting in a measure that will completely lock them down, as I said, this is clearly on the table, and it is something that we will, the government will announce or put this measure in place as soon as we feel that it is now necessary to do that. We have to assess and balance some of these things. I had somebody from NTV, Helen Aura. You wanted a response to what we are seeing, and I saw that in the media as well, the protests in KMTC by people who are being quarantined there in Nairobi KMTC, and I believe also in Mombasa. Listening to those protests, it appeared to me that the main issue that these quarantined persons were complaining about was the fact that they were staying in quarantine much longer than they thought they should have. Indeed, if that is happening, I can only think of one reason why there may be a delayed transmission of results to quarantine. If you have seen, we have ramped up our testing capabilities, and you know that we have told you on many occasions that our testing capability is also restricted, is constrained by the commodities and the supply chain that we use for this testing. We may have a temporary snag in terms of these supplies, and that might have delayed the testing of some samples. We may have a backlog of samples that we need to clear. That could be one of the reasons. What I can assure you is that we are working on clearing up this backlog, because we also do not want to keep people in quarantine longer than they should actually be there. So these are issues that we are addressing to see how we can speed up this. The other thing that you must also remember is that we are looking at cases throughout the country. We are working closely with the counties, who are the owners of service delivery within the counties. And so there is a level of coordination also between the counties and the national government in terms of the testing and relaying of information and all of that. So we're also working to streamline those levels of coordination so that people can be released in good time once their results are out in good time. Okay, the political issue about political leaders and the application of the law, again, I want to say that as a Ministry of Health, we have made our statement that the containment measures apply to each and every one of us. There is no distinction. And we want to repeat again, these containment measures are still in place. The containment measures regarding gatherings are still firmly in place. We have not made any change to that. So until such time that there is a change or a relaxation of these measures, they apply. And they apply to every individual equally. Now, in terms of then determining how individuals who flout this are handled, that is a domain that is outside the Ministry of Health. It falls within another ministry, and I think that is probably where the right question should be addressed. Thank you.